Thank you for joining us here at New Teeth Now. So, what a perfect way to start your summer. We have a lot of vacations coming up, we have a lot of reunions, we have, weddings, graduations, and I know that you want to look and feel your best for all of those. And with a brand new smile, you do look and feel your best. So let's talk a little bit about New Teeth Now with Dr. Richards. How are you doing this evening?
Good, Emily. How are you?
Good, good. Are you ready for the webinar?
I am, absolutely.
All right. I just want to let you know I edited your slideshow a little bit, so we'll kind of roll with it as we go. So talk to me a little bit about yourself.
Well, I'm a Lakeland native, and after high school I went to college up in Atlanta, Georgia, and I went to dental school up there as well. After completing that, I did a 4-year oral surgery residency in Jacksonville, Florida, and that included a year of doing general anesthesia as well as 3 years of doing surgery on all sorts of things, and a lot of medical rotations and things like that. And I came to Lakeland in 1980, so I've been back practicing here doing this kind of work since 1980. That 37 years went pretty quick.
Wow.
So, yeah.
A long time.
Kind of got old and lost my hair, turned gray. So.
I think it's safe to say that you've definitely been placing implants for a very long time now.
I've done a few, yeah.
Very nice.
Yeah, absolutely.
How long has this New Teeth Now procedure been around?
Well, you guys will meet Dr. Musser later in the presentation, but he and I, we've been fiddling with this since probably around 1983, 1984, in one form or another. Teeth in a day, teeth in an hour. We've done teeth in 3 days, teeth in a week. We've done just about everything that you can do, and we've settled into this regime now, which we call New Teeth Now, and we've been settled into this for probably, 10 years, maybe something like that. And it's very repeatable, it's predictable, and as the viewers will see, the facility and the whole business concept has kind of grown around the New Teeth Now concept. So,
what's your success rate for New Teeth Now like? What are your results? I mean, obviously I know, but I want you to let the viewers know.
I can't remember a person who we haven't been able to make happy. We may not have made them happy with their first set of teeth, but we definitely got them happy at some point after the healing was complete with the final teeth.
Right, because there is a first set of teeth, and that's actually a question that we get a lot, and I'm surprised you guys haven't even already typed it into me. But usually a lot of people say, well, how do you do teeth in a day? But we do teeth in a day, but the first set of teeth they leave with is not their final set, correct?
That's correct. That's
okay,
correct.
Talk to me a little bit about that process.
Well, we discovered a long time ago that trying to make the final teeth too early is just not the best process. You get changes in the soft tissue. Some people will find out that they don't like the teeth that they originally selected. And so, and also, more importantly, that the material that the teeth are made of. If you're doing like teeth the same day and those are the final teeth, are an inferior strength and an inferior product that the teeth are made out of. So for those reasons, for being able to make a second set of teeth out of a superior product, we do a zirconia porcelain set of teeth for the final teeth. Being able to adapt the teeth to the tissue properly so there aren't any big gaps under the teeth. And then finally, being able to test drive, so to speak, a first set of teeth, the size and the shape and the color of the teeth that the person initially picks out may not be what they want, and so when the final teeth are made, they get to change the size and the shape and the color of the teeth.
And that happens quite a lot.
For those 3 reasons, we do not do the final teeth the same day, the next day, in 3 days, or even a week. Not to mention, I would say the 4th reason is we like to make sure that all of the implants are bonded solid with the bone.
But
And so, you know, that takes 3 or 4 months.
Right, but the day they leave the office, and I've seen them with my own eyes, nothing's covering the roof of their mouth. These teeth are fixed into their mouth. They cannot take them in or out themselves, can they?
Right. The teeth that a person leaves with on the day of the procedure is what used to be the final teeth. Back before, 6 or 7 years ago, before we started offering zirconia teeth, acrylic teeth were the final teeth.
Okay.
And so the teeth that our patients leave the office with on the day of the procedure are what we used to offer as the final teeth, and what a lot of doctors still offer as the final teeth.
Oh, wow. Okay, so
So-
we're really upgrading them to the zirconia, and it's just...
Oh, yeah, the zirconia is a huge upgrade for which a lot of people charge a lot more, but because, and we'll talk about the business model in a few minutes, but because we've brought everything into one central location and we own it all, we're
Right.
able to do things and keep the price down.
Right, because you've
So,
got the technicians that
We've
work
got
with
everything
the zirconia.
in-house, and that's, I know we're going to talk about the business model.
No, we've got lots of time, so
Yeah.
it's not a big issue.
So,
I did want to bring up the fact that you are a board-certified oral surgeon, and we can actually take a look at your slide. It's got a couple pointers about yourself.
right.
What's so important about being board-certified?
Well, not only am I board certified, but Dr. Musser and Dr. Kirkpatrick are also board certified, and that means that we worked for a while, and then we took a written and an oral examination from a panel of our colleagues, and were able to complete those examinations up to a standard that is established by our parent organization. And so when you become board certified, it signifies to the public that you have met a standard that has been established by your colleagues.
So it doesn't matter what sort of surgery you're going into, you really want to make sure that that surgeon
Yeah,
is...
regardless of
Right.
what discipline it is.
Very interesting.
And most hospitals now require a doctor to be board certified, and of course we're all on the staff at Lakeland Regional Medical Center and actively participate out there as well.
That's what you
So
do on your day off, isn't it?
It is, and my evenings after work.
Yes, it is. So he's usually at the hospital if he's not here. And actually, our facility, we do take a lot of the patients from the hospital, and we're able to treat them here,
We
aren't
do.
we?
We do. We do a lot of jaw fractures here and other things. Yeah.
Because of the building that these amazing doctors have designed. So back to New Teeth now. What is the whole concept?
Well, the
Show me
concept
an image.
is to take someone who maybe has a mouthful of bad teeth, someone who is miserable with dentures, someone who maybe has been told they don't have enough bone for implants by another doctor, someone who has advanced generalized periodontal disease, and so they're losing their teeth, or all of their teeth are in terrible shape.
Right.
And what we give them is what you see on the screen. And this is an upper, and so you've sort of got Superman eyes. You're seeing through the tissue. You're seeing that this is what the implants are like up in the jawbone. And then these are the teeth. And like I say, this is an upper. So it's a bridge that goes around the arch. And the palate is totally open. The palate
About
is
to
not
point that
covered.
out. Yeah, that's so cool.
And the bridge is retained by little screws rather than cement,
Okay.
so that a lot of people who get their teeth cleaned, we just unscrew their teeth, take them out and clean them, and then put them back in. So they're not sitting with a dental hygienist picking around on their teeth to clean their teeth.
That's actually one of the questions that we had come in on the chat, and they were wondering what is the maintenance like on these teeth, and would they want to go once a year? Would they go every few weeks? Like, how would they keep these teeth clean?
Well, once we have given the person their first set of teeth, we have an opportunity during the healing period to observe them over 3 visits, let's say, and counsel them and give them instructions on how to keep their teeth clean.
So you get to know all of their bad habits and good
We
habits.
do, right. And so for most people, by the time they have their zirconia porcelain second set of teeth, they're already used to cleaning the fixed bridge because they've had the temporary fixed bridge. And the cleaning is basically a toothbrush, toothpaste, water pick, and little bottle brushes that go between the teeth and the gums. And any of you who have a bridge on your teeth, and we have some x-rays of other bridge work on teeth and other bridge work on implants, you know that you cannot floss in between these teeth because it's a bridge, it's all connected. And so you have to clean between the teeth and the gums. And so the maintenance is simple.
Got you. And then another question, a little off topic from the cleaning, but I do want to get around to it because I think they asked it a couple minutes ago. They were just wondering what brand of zirconia that we use.
Well, presently we're using the Zircon Zon zirconia.
I'm glad you answered
that. Was
that.
the pre-towel?
That's the pre-towel, right. Yeah, they were the originators, and we have the Zircon Zon milling machines which accept the pre-towel Zircon Zon zirconia.
We actually have a block of it, that's pretty cool.
This is a block of zirconia. It's pretty thick, and the milling machine has carved a framework. The milling of this may take 6 or 8 hours. And the process for completing these teeth may be 3 or 4 days.
So you really have to have specialized technicians that know what they're doing and how they're working with this in order to even fabricate. What's the final product look like? I'm just curious because I know you've got it sitting right there.
Yeah, we've got a set of teeth over here, and this is an actual set of zirconia with porcelain, and they're actually quite heavy. I'm kidding.
You don't perceive that weight in your mouth though. If we were to extract,
they're a lot heavier than plastic, but
right.
These can be made with any size, shape, and color, and they're very natural, and they reflect light nicely, and they're not porous like acrylic, so they're easy to maintain. And they will stain. A lot of people go, well, the teeth stain, and certainly if you're a tea or coffee drinker or a cigarette smoker, they will stain just like porcelain caps. But they can be cleaned because they're glazed porcelain.
I need some of
those. But they're very nice, you know. I mean, they're very nice. And then finally, what you see on the screen now is the lower, and the lower is also a bridge. And you'll see this artificial gum. You don't see as much of that on the upper. And basically, the artificial gum sort of fills in the gap between the teeth and the person's gum. Some people have a lot of bone and gum loss, and other people do not have a lot of bone and gum loss.
Question about the zirconia, just going back to it. People are asking, do they chip or break? And I know for a fact they don't chip or break as easily as acrylic, but I mean, it's not completely indestructible, or would you say it is?
Well, it's not completely indestructible. If you put that on the floor and hit it with a sledgehammer, you could probably chip it or break it.
Right.
But in the natural course of eating, you know, the type of foods that most people are going to eat. Now, you know, if you're out opening up beer bottles with your teeth and eating the bark off trees in your backyard and stuff like that, I mean, you might
maybe chip it off. I'll be honest.
In eating normal food, you're not going to break this stuff. It's very strong.
I will be honest. Holding this, it feels
it's
solid.
Substantial.
It's very, very solid.
Yeah.
And I actually have a zirconia crown.
Well, this material is used in dentistry for crowns.
So I actually have one, and it feels just like a natural tooth, because when they transitioned me from my temporary crown to my final crown made of zirconia, I was shocked because I was like, oh, I can't tell the difference in my mouth between that and my other teeth. Yeah. So, and I mean, it's withstanding me so far. How much longer do you think I got left with it?
A long time.
A long time?
Yeah.
Good.
So this is a lower, and I think I mentioned a while ago about the pink, which is the artificial gum, and I can't find the little mouse pointer, but there it is. And these are the implants, and then as you saw in the other slide, where the screws attach the teeth to the implants, and then the holes. A lot of people go, well, you got holes there, and these holes are filled at first with some rubber cement, and then later with dental filling material.
Oh, wow.
So that there are no holes to catch food.
So, what sort of people would be, and we kind of touched on it earlier, but what sort of people would you say need this sort of surgery?
Well, I did touch on that. Most of this started in the 80s with denture wearers, miserable denture wearers, and it was almost exclusively for the lower jaw. And then gradually we started doing the upper jaw, but the upper jaw had a lot of peculiarities anatomically, and there was a learning curve to dealing with the upper jaw. The other group or groups that came along after the denture wearers were the people with a mouthful of bad teeth and periodontal disease, and or a mouthful of bad teeth with periodontal disease. So some people are like double diseased. So those folks who, and then there's another group of folks who take meticulous care of their teeth. Go to the dentist every 6 months, their entire life, only to be told they're losing all their teeth to periodontal disease.
Oh, wow.
Or they go to the dentist their entire life, the dentist sends them to the periodontist, and they still end up in a situation where they're losing all of their teeth. And so those folks are horrified to go into dentures, which are big pieces of plastic that go into your mouth. And so those are the groups of folks who are going to benefit and who over the years we have helped. Now, because we employ some unusual techniques here, some very advanced techniques with zygomatic implants and tilted implants and even advanced zygomatic techniques, we have been a place that somehow people with no bone have found us.
Right.
And I have seen 2 people in the last week that had no bone for traditional implants, and they each received 4 zygomatic implants because they had no bone for anything else. And so we sort of have become a center for people who have had failed implant surgeries once or twice. I know I took care of a lady with 2 or 3 failed procedures at major universities. I know that Dr. Kirkpatrick just took care of a lady who had had 2 failed procedures from well-known implant people.
Right.
And we basically bail those people out with advanced techniques, and they were both upper jaw failures. And so the advanced zygomatic techniques that we offer, that we have developed a lot of expertise because of the number of these procedures that we do.
Well, I know for a fact, because I answer the phones, and you probably recognise me from the voicemails, and I will be calling everybody after this webinar, but I speak to a lot of patients that tell me, oh, no, I can't have this because I've been told I don't have enough bone. It's going to take years of bone grafting and things like that. But like you said, there's only a handful of surgeons in the world that are specialised in this type of implant known as the zygoma implant, and actually one of them is sitting right here with me today. So it's an honour to sit in front of you.
And the company that makes zygomatic implants, the Nobel Biocare company, has told us that we purchase more zygoma implants than anybody else.
Wow.
So we do a lot of them.
Number 1 buyer.
Yeah.
So there is one guy that you've helped out, and we actually have a video of him. His name is Bruce Cerny.
Right.
Yeah, you're pretty familiar with Bruce, aren't you?
Yeah.
I just want everybody at home to watch his story. It's really moving. And I think you had a huge impact in this man's life. I think you have an impact on everybody's life, but let's go ahead and watch, because this is a really, really good movie.
I used to smile constantly. Every picture that was ever taken of me, smile ear to ear. Now, not so much.
We've been married for a year and a half now, together for 2.5 years. Sadly, he doesn't smile like he used to because he's so self-conscious.
I started losing more and more teeth, and that's when I went to see Dr. Richards at Florida Dental Implants. After I had the surgery done, and after they put my new teeth in, and they handed me a mirror, the thing I'll never forget was looking in that mirror and seeing a full set of teeth, perfect teeth in my mouth. I started to cry. My wife, I mean, she loves me, no doubt. The turnaround was the first time I kissed her, passionately. Talk about a boost. My ego is through the roof. It was amazing. New teeth now is the way to go. I wouldn't go with anybody else. I wouldn't.
So I absolutely love that, you know, and I see you leave that impact with nearly all of your patients. You spend so much time with them. I know, I see you every single day in the office with them. Another thing, which is pretty cool, and I did include this clip, and I don't want you to be mad at me for it, but there is a video of you riding a Harley with Bruce. Is this true?
That's true.
Let me see that clip. So this is really cool. It's like seeing you out of your scrubs, like you're an actual human, but then seeing you create these miracles. And
then I'm an actual human.
well, you know, you're a very special doctor. You probably don't realise it on a daily basis. But I really love that you guys, you know, that you really interact with him. Do you still hang out with him and talk to him or get in touch?
I talked to Bruce around Bike Week.
Did you?
Daytona Bike Week is in March. I talked to Bruce around that time, but and I'd hoped at some point to get together with him and some of his buddies, and I'd still like to do that. I just haven't done that yet.
If you've got any time between the hospital and here, and you know, transforming people and changing their lives, you know, that is a nice little outside of work thing that you got going on. Yeah. How long ago did Bruce have his surgery? Do you remember?
It's been probably at least 2 years, maybe 3.
2 years, and he's doing great. He's in his zirconia.
As far as I know, yeah, he's done very well. I haven't heard anything to the contrary.
No, that's awesome. Yeah. And just because it is a live webinar, and I do want to let you guys know, we can get you in touch with everybody that we show on here. Bruce Cerny is somebody that obviously Dr. Richards has hung out with outside of work, but is somebody that can vouch for this as well, along with several of the patients. How many of these patients do you do a month, let's say, would you say?
I've got 13 scheduled in May.
Wow.
And I think we've been doing 26 or so a month. I haven't done all those, but May, for some reason, I was looking at the schedule today because I'm leaving near the end of the month. Mm-hmm. And so this is not something that we do occasionally. This is our main business. We do other oral surgery things, but that has become secondary to this business. Mm-hmm. And this is what we do, and this is what we are, and this is what our business model is designed around, and it's who we are.
And you spend, your entire day is focused on that patient. So 15 or 13 cases, you said, 13 days out of this month, you will have a patient a day, correct? So your whole day is really that whole morning.
Well, almost. I mean, while the person is recovering, and we can talk about that. Why don't we go to the next slide and talk about that a little bit, because Emily's leading me into here's what we do. But after all the prep work is done, most people who have this are in an older age group, and we see a few young people, but a lot of people are in an older age group. So the prep work would include a medical clearance from your physician, and of course we review your medical history, do a thorough exam, review your CAT scan with you. In a lot of situations, Dr. Dibbs, the restorative dentist, will meet, examine you, talk to you, and then in some cases, depending on the degree of your medical history complexity, one of our anesthetists may call you at home to talk to you. So there's some prep work that goes into this because it's a big deal.
Right.
And then if you look at this slide, and we can start off with number one of the nurse anesthetists puts you to sleep. And this is not IV sedation, this is not conscious sedation, this is not some pill that you take, this is we put you to sleep. This is general anesthesia, and you are totally asleep, just like in an outpatient surgery center. So then if you have teeth, we remove those teeth and install the implants. And if you do not have any teeth, then we just do what bone work we need to do and install the implants. Then we take impressions after the implants have been installed, and bite records and other things that need to be done to be able to prepare the first set of teeth. Then our in-house laboratory takes about 3.5 hours to fabricate the first set of teeth. Maybe a little bit more than that if it's both jaws. So then in the afternoon, about 4, earlier for a single jaw, but around 4 o'clock for a upper and lower jaw, we put the first set of teeth into your mouth, and they're held in place with little screws like you saw on the other slides. We adjust the bite, make sure everything fits well, and then you go home. Then you'll visit us periodically over the next few months so that we can keep an eye on your healing, get your stitches out, just make sure everything's okay, the screws are tight, and as we discussed earlier, give you some technical tips on your home care to keep your teeth clean. And then finally, after 4 or 5 months, we create your final teeth. Dr. Dibbs does that part, made from zirconia. So that's a summary of what happens. Most of that happens the first day. The last thing, creating the final teeth, that doesn't happen that day. So if a person looks at the span of time to get the final teeth, they're probably looking at 7 months, maybe 8. But 4 to 5 months of that is healing. Typically 4 months if you have traditional implants. Typically 5 months if you have zygomatic implants. And then the rest of the time with Dr. Dibbs is spent having the final teeth made.
That was actually one of our questions, was how many visits, and I know that it's different for everyone, and I'm sure you're going to go into that.
A minimum of 6 after the procedure.
Okay. So 6 visits.
Minimum of 6. And some of that, if you are a finicky about your teeth and you get to being very critical about the setup with Dr. Dibbs, and they have to do a setup and you want to make some changes, then they have to make some changes and you come back another visit.
Got you.
However, that being said, we do make special concessions for people who come from long distances to be able to do multiple visits in 1 or 2 days. So we have the ability, if a person came down and they came in on a Monday, we have the ability to finish the whole final set of teeth by Thursday.
Oh, wow.
And
that's probably a little bit more for our patients from around the world.
Yeah, people that come from a long distance.
Yeah.
Right.
We do want to expedite it, but we also don't want to destroy the quality.
Yeah, well, that doesn't destroy the quality. It just gives them time to do all of the steps that need to be taken.
Done.
So.
And healing. So talk to me a little bit about the average implant business model, because you know that there's dentists out there that have this whole teeth in a day.
Right.
They literally mean teeth in a day, and they never do any follow-ups.
Right.
And we've treated a lot of their patients.
Well, in addition to the teeth in a day, we do typical single, double, triple, we do regular implants as well, like other people do. And in the average implant business model, like you see here on the screen, the implants are placed at the surgeon's office, and then the person travels to the restorative dentist's office, and then the surgeon and the restorative dentist interact with an outside dental laboratory. And this number 4 wouldn't necessarily apply to just, straight up single implants, but we can talk about bone grafting in a minute. So But the point being, with an average practice, there's a lot of running around. Sometimes the left hand doesn't know what the right hand's doing. And we recognized back in the early 2000s when we designed the first part of the office that business model didn't work well for complicated stuff. When you have complicated stuff, you need everybody all piled up together so you can have conferences, and if there's a problem, everyone can gather up and look at it together. And so that's why we have our business model. That's why this office is what it is, because we place the implants here, and we have an anesthesia department. We have a full-time restorative dentist who does nothing but implant teeth. And because we do advanced techniques in the maxilla, which is the upper jaw, with our zygoma techniques and our tilted implant techniques, we don't do any sinus bone grafting, so we don't have additional stages that are typically required of doctors who are still doing this type of work the old-fashioned way, with sinus lifts and that sort of thing. And so because we have the in-house lab, the in-house restorative dentist, then we can make that set of teeth the same day. So that works out very well. And I have to tell you that, and Emily just sort of briefly mentioned something about the subject, you really do need to be careful about who you go to have this work done. There are not many people like us.
Nope. We have treated.
There are a lot of dentists who take weekend courses and this, that, and the other, and start placing implants. Not all surgeons have the same capability. Not all heart surgeons have the same capability. Not all orthopedic surgeons have the same capability. Not all oral surgeons that do implants have the same capability. And once folks understand that, and this is definitely not something that you want to go around shopping to get the cheapest price, I can tell you that.
Right.
Although when you look at price, we actually are, when you look at other people who do or try to do this concept, we are the cheapest.
Yes.
But you really need to be careful in selecting who you're going to go to have this kind of treatment.
Actually, the next slide is all three of you guys.
Right.
And like you were explaining, you are a specialised group.
Right.
You've been doing it for a very long time.
Right.
I mean, they're not really even teaching this stuff in schools. I mean, they are.
Well, what we do, this teeth in a day, there are a lot of dentists out there that don't even know that it exists. And if you told them about it, they wouldn't believe that it really works. We've had some dentists come over and spend the day because they didn't believe it could be done.
Right.
And so they come in the morning and they watch the procedure, and they follow all the impressions up to the lab, and they sit with the lab technicians, and then they follow the teeth back down to the clinic and watch them go into the person's mouth, and they're like, their jaw's hanging open.
Well, I don't know how I have a job because...
Yeah, we just had, just in the last 2 or 3 months, we had 2 or 3 people come through here, and, they never knew, wouldn't have believed, and were shocked at the end of the day. So a lot of dentists will not recommend this to their patients because they don't know it exists. Or they may have heard of it, but it's so out there that they can't recommend it because they can't believe that it could possibly work.
Until they see it.
Until they see it.
And I was the same way. That's why I said I can't believe I have a job. And I'm not joking, because when I got hired here, I was like, okay, what's the catch? You don't do teeth in a day. From school, from everywhere, I was taught, no, it's done in stages. It has to be done like this.
Right.
But when I saw people coming in and leaving the same day and understanding the whole process, because it is teeth in a day, but there is a healing phase, then it made sense. And working underneath these 3 doctors, and actually I've sat in surgery with you, haven't I, and watched it.
Right, you have.
Amazing transformation. I do want to talk a little bit about the zygoma implants.
Okay.
Because
I'd like
you guys
to talk
are
about
specialised
them.
in them.
Yeah, we do a lot of zygoma implants.
Go ahead and talk to me a little bit about that.
Well, the zygoma implants were invented by a German orthopedic surgeon back in the 80s. And they were used to reconstruct people's faces with prosthetics when they had, let's say, their nose or their cheek and their eye removed because of cancer. And so they were looking for methods to attach these lifelike prosthetic devices to the person's face. And so they invented long implants, and then it sort of morphed into this and that. And then finally a lady named Chantal Malavez from up in Amsterdam or Holland or somewhere up in there, I can't remember exactly where, she took that concept and kind of ran with it. And started using it for the severely shrunken upper jaw. So she started doing a lot of that. And then the technique sort of spread around through Europe, but not a lot. And then there was a guy here in the States, Ed Petrosian, out in Seattle, that picked up on it early. And a lady in Toronto by the name of Leslie David that picked up on it because she was friends with Chantal Malavez.
Wow.
So, you know, I'd had some patients that had failed sinus grafts and no bone. And so I went to a meeting and I learned about zygomas, and I went to the company and I said, you guys got to hook me up. And so they did, and I went to Toronto with Leslie David back in 2006.
So
I
hang
think it
on,
was
you
October.
met Leslie
2000.
David.
Well, I went to her office and assisted her in placing 3 zygoma implants.
This is news to me. I didn't even know this.
Back in, I think it was October, November 2006. And then I came home the next day, and then I put my own zygoma implants in on my first patient about 2 or 3 days later.
You practiced with one of the very few people that even knew.
Yeah, and she learned from
about them.
Chantel, so it was kind of neat. And then I've been to a couple other meetings where both Chantel and Leslie were there, and Leslie and I've kept up over the years. I'm going to see her in August this year.
Oh, wow.
But so the technique has actually changed over that period of time from 06, 07 to now. It's totally different. Much more predictable. The implants are much more solid, and it's an extremely predictable, solid implant when you don't have any bone in the upper jaw, and it virtually eliminates the need for sinus bone grafting.
And just to recap, a woman was the one that, you know, found this
I
out
learned
and
from a
stuff.
gal, Leslie David up
One
in
for
Toronto.
the women.
Yeah,
That's right.
yeah.
But that's really
So-
cool that you actually learnt with her. I didn't know you were hands-on with the actual person that learnt from the person that even found out about them, which is awesome. And the x-ray that you were showing. So is
If
the
I can
healing...
find my pointer. So these are the zygoma implants, and
Yeah.
they're long because they plug into the cheekbone right here. Just under your eye and off to the side is the zygoma bone. So they plug in there. You don't feel them, but they're very solid. And I like this x-ray, and the other reason I like this x-ray is because a lot of folks will ask questions about bridges on implants.
Yeah.
And over here on the left is a bridge on teeth, and it involves 1, 2, 3 teeth. And on the other side is a bridge on implants, and it involves 1, 2, 3 teeth. And some people think there's some mystical thing about implants, but really they're just artificial teeth, and it's just a bridge. So this bridge that attaches to these implants is no different than the bridge that attaches to these implants. It's just a bridge. And the bridge up top that goes from that zygoma implant all the way around to that zygoma implant, it's just a bridge. It's just longer. That's all. So it's really nothing special, but it does take a special group of folks gathered up to really make it happen.
And which one's going to last longer? The bridge on the natural teeth or the bridge on the implants?
Well, if you don't clean under this really well, you will get tooth decay, and you will lose this bridge with tooth decay. Whereas the implant will not develop tooth decay.
Right.
So you take one of the most common causes for failure out of the equation. anyway, it's a nice X-ray because it shows a lot of information.
No, definitely. And I think the next one is the mini implants.
The mini implants,
which
right.
I really want to talk about. But before we do get into that, I just want to answer a question so that you don't think that you're being ignored. There was a question about the risk of nerve damage. And I think we've got a couple slides coming up about the CT scan that we do.
Right.
To prevent...
Well, the risk of nerve damage is very small. Typically, the nerve is related to the lower jaw, and the nerve comes out of the brain and it goes into the inner aspect of the jaw back here, and it travels inside of the jawbone up to some little holes right here. They're called the mental foramen, and the nerve comes out of that mental foramen. It's about the size of a cooked spaghetti noodle. It's not microscopic at all. And then it branches out and supplies all the feeling to the lip and the chin, in addition to giving off branches that supply the feeling to the tissue inside the mouth and the teeth. So the CAT scan shows us where that nerve is clearly, so that an implant can be selected which is of the appropriate length. So implants come in different diameters. They come narrow and then a little bit wider and a little bit wider and then really fat. So they come in different diameters and they come in different lengths as well. Like the length might range from 1/4 inch up to 18 or 20 millimeters, 3/4 of an inch. And the diameter would range from, say, 3.5 millimeters all the way up to 6 millimeters, 1/4 inch. So there's a wide variation in implant diameters as well as lengths. And nerve damage, we don't see much nerve damage.
Well, you need a steady hand to do it.
And just know where you are, so don't see a lot of that.
So they can come in and I can do it, right?
You could, probably.
Yeah.
Yep.
Totally. No, I'll leave it.
We don't do mini implants because mini implants aren't beefy enough to support the type of teeth that we make for people. But we do undo a lot of mini implants.
I was going to say we replace a lot of mini implants.
You know, sometimes we feel like that plastic surgery program botched. You know, where people go to these two guys and with problems that have, you know.
I love that show.
And so, you know, we see people who've been botched and who have failed situations, and not that we're perfect every time. Nobody is. Okay, nobody's perfect every time. But we're able to get stuff accomplished most of the time.
I do think you're being a bit modest here, because I'm not going to lie, and just working for you guys, and I've only been here a couple years, I think I'm coming up to 2 years now, and you're pretty perfect.
Yeah.
I
don't have anybody mad at me, let's put it that way.
Yeah, and you've been doing enough of them that,
Yeah.
you know, you should have a few more complaints than I was anticipating, but so far so good.
Been very fortunate with that.
And we do have another question coming in. Are the implants typically placed in the extracted tooth sockets?
That really isn't a topic for this Teeth in a Day webinar, but yes, as long as there is no infection, and as long as the bottom of the tooth socket and the nerve aren't, in other words, if this is the nerve and the tooth socket is sitting right on the nerve, then I tend to shy away from placing the implant the same day I remove the tooth. Because if you go like even a millimeter deeper, you could injure the nerve. I like to see where the nerve is here and the tooth is at some distance from the nerve. And then looking at the cross section of the CAT scan, sometimes the tooth will sit well to the inside and the nerve to the outside, and you don't really appreciate that relationship without a CAT scan. So the relationship of the nerve to the tooth socket and whether or not there's an infection are the two factors that would determine whether I would place an implant into a tooth socket the same time I remove the tooth.
And just to clarify, and correct me if I'm wrong, but we do not do an implant in each individual missing tooth. You're going to have 4 to 6 implants, is that about right?
Right, typically 4 to 6 on the lower, and typically a minimum of 6 on the upper, unless you don't have enough bone for traditional implants and you have zygomatic implants, in which case you get 4 zygomatic implants.
Oh, wow.
So
Just
I
like
did two. I did one, a lady last week who I saw today, and I did one today. They had 4 zygomatic implants because they didn't have enough bone for traditional implants.
But she's still left here with teeth.
Oh yeah, absolutely.
How about that? So go to the anesthesia, because I do want to talk a
Okay.
little bit about the difference between general anesthesia
Right.
and just sedation. Talk to me a little bit about that. What is the difference?
Well, with general anesthesia, you're with whichever anesthetic agent is being used. Your central nervous system is depressed to a point to where you could have any sort of procedure, mouth, abdomen, feet, whatever, without having local anesthesia. In other words, you are asleep, so that you could have an abdominal operation. With IV sedation, the area to be worked on is going to require local anesthesia because you're sedated. You're not totally asleep. You're not surgically asleep. So most all of these procedures are done under general anesthesia. And one of the main benefits is that when we are preparing the jaw with the electric drills, when we're I hate to get too technical and scare people, but when we're making the holes in the jaw to put the implants into, we use a lot of coolant. We irrigate with a lot of sterile saline. And if you took a sedated person and they're laying back with their mouth open and you start squirting water in their mouth, they're going to choke on it.
Right. The airway
And
is
they'll be
just...
swallowing it down the wrong
open.
hole. And we
Yeah.
all know what it's like to swallow something down the wrong hole.
Yes.
Okay? And so you take that sedated person, they're laying back, their mouth is open, they're numb, and now you're squirting water in their mouth. It just doesn't work.
And
they're
that's
going
how-
to choke. And so when you're under general anesthesia and the breathing tube is down and there's a little balloon on the end of the breathing tube and that's inflated, and then we put gauze back there so that if any piece of tooth or any little screw or anything like that was to drop, it would be caught in that screen, the gauze
Right.
screen. Then we can get in there and do what you'd say, go to town.
Right.
Okay? And we can use a lot of coolant and irrigant, so that's better for the bone. And we don't have to worry about choking and all that sort of thing. So it works out for the person having the procedure because it's lights off, lights on. A lot of you out there are of the age to where you've had colonoscopies and endoscopies or operations, and you know what that's like. I mean, I have, and you're sitting over there after having a colonoscopy, and boom, you just wake up. And it's
Right.
like never happened. So general anesthesia is the ticket when we can get medical clearance for general anesthesia.
I was going to say a lot of offices do use the general, not just the regular sedation. And
Right.
I think that's crazy. You know, you're, like you said, it's a couple hours at least under anesthesia, and you do not want to be in twilight zone for that. You want to be
Yeah.
completely asleep. And we have 2 amazing people here that
We
are
do.
capable of
Yeah.
doing that. And I think a lot of offices, you know, don't have that. They don't have people like Jack or Kim.
Well, what you have to understand that there are state laws that govern who may administer anesthesia, where anesthesia may be administered. And because all 3 of us have licenses to administer general anesthesia, and our office is inspected and certified, and we have a generator just like in a hospital, that if we're working on a summer afternoon and a thunderstorm comes up and blows the power out, our generator comes on automatically. So we have all the safety equipment. We have trained nurse anesthetists who work for us.
Yep.
We are all certified to give general anesthesia. And what you have to understand is your general dentist, they don't have any of that, nor do the periodontist.
Right.
So when you start talking about a more sophisticated anesthesia, you're going to be in a more controlled environment.
Yep, and
Yeah.
you have all the staff to do that. So we have Kim Cherry, who's been doing this for what, 25 years?
Long time.
Yeah, or
Yeah,
more. This is
she
an
wouldn't
older.
want you to say that, but
She doesn't look it. She doesn't look it at all.
Yeah.
And then we've got Jack, and Jack Daniel. That's a pretty cool name. Is that really? That's really his name.
Patrick
Isn't it? Yeah.
Jack Daniel, yeah, that's his name.
That's an awesome name for somebody to put you to sleep with.
Yeah, and these are both people that have been around and worked for various clinics and hospitals, and they enjoy the outpatient interaction and the outpatient experience rather than the hospital experience.
I definitely know Kim did a case that one of the head of anaesthesia over here in Lakeland was worried about, and he said, you know, this patient really is hard to intubate and things
Yeah.
like that, and Kim did it within seconds.
Yeah.
And that was just pretty incredible to watch. But that's got to be a huge relief for a lot of patients that have a fear of the dentist. Probably
Right.
a reason that you're watching this, you haven't been to the dentist in a while, you have a lot of anxiety and fear, and I think being put completely to sleep, like you explained, just helps relieve a lot of that. I actually have a clip of a guy called William Knight, and we're going to show you his clip, and his story is so sweet just because he was really, really nervous and not wanting to do this, and he said he would do it again. So let's watch that.
I never even called Florida Dental Implants. I didn't even want to go that far. I just, on the website there's a picture of the building, so I knew what the building looked like, and I got their address. And I got in my car and I just drove here. No appointment, no anything. And I drove here and I just looked at the building. I think I went back home. That's as far as we got that day. On the second attempt, I still didn't call, and I came to the building and went inside, and I met the receptionist. They took time out of their busy day to see someone that didn't even have an appointment, and that was a great day, because without that day, none of this would have happened. Nothing to be afraid of. And there's nothing to be afraid of the day they do the surgery. When they do that surgery, your sleep, it's pain-free. Believe me, it's pain-free. I'm one of the biggest babies in the world. And I'd do it again if I had to. I'd do it again.
That is what I absolutely love. I think the staff that you've employed, the fact that he came into the front desk, he visited the building.
I think he left.
He did.
I think he drove up
He
to it
drove
and
up
left
and
the
left.
first time.
Yeah. And just the fact that finally he plucked up the courage to come in,
Right.
had this surgery, and he's willing to tell anybody and would do it again.
Oh,
That's
he actually
amazing.
was in one of the last times, and he was showing me how he uses knitting yarn, and he threads it up under the teeth and shoe shines the teeth with knitting yarn. And he said, "Man, I'll make a video for you to show people how to clean their teeth." But he's a nice guy.
Yeah, that is so sweet. And you know, there's so many people out there that are struggling and are going through that. We had another guy, apparently he'd called our number several times, and finally I spoke to him actually, and he finally booked, and he said, you know, every time I've called, I've just hung up immediately. And I'm thinking, I know this person, because I get this phone call all the time throughout the day, and people just hang up. So the fact that, you know, we enticed him and brought him in here just makes me really happy.
Yeah. Well, you know, this is a big deal, and you know, it's a big decision. It's a big deal, and you know, people just want to make sure they're making the right decision. You know.
Definitely.
So, I'd like to show you. This is what you would see if you drove up. You could do like Mr. Knight and just drive over one day and pull in the parking lot and get scared and leave.
Oh.
But or you can come in, have a cup of coffee, and then leave. But this is the front entrance, and this was the original building. This back here was not the original building. This was a vacant lot that we owned. And so the original building we put up and moved into November of 2002. And then Dr. Kirkpatrick joined us about 10 years ago. And things kept growing. We outgrew this office, which was about 7,500 square feet. And we said, you know, we're pretty happy that nobody ever bought that lot. And we started talking about what we were going to do, and we finally decided, knowing that most people build something too small and outgrow it way too quick. We decided to build something that we thought maybe was a little too big, but we've already almost, I mean, it's full, as you know.
Right.
So upstairs on the front is the lab and offices of the implant treatment coordinators. Downstairs on the front are 2 operating rooms, complete with private recovery rooms. And on the back side of the top is Dr. Dibbs, who you will meet in a few minutes. He's our prosthetic restorative dentist. That's his domain. And downstairs on the back side is the Dr. Kirkpatrick Memorial Wing. Not memorial, but wing. The Dr.
Each
Kirkpatrick
doctor have
wing.
their own wing.
Not memorial. But so that has been a wonderful addition. We opened that facility in the summer of 2013, as you know. You were here
So
then.
you
maybe
are
maybe
a
you weren't
surgeon
here.
by day and an architect by night.
So that has worked out pretty well. Our operating rooms are not unlike any other operating rooms. They're large, and there's a lot of equipment, anesthesia machines, and carts, and this, that, and the other. So they have to be pretty big. They're also very cold.
Yeah, freezing.
We have a 35-seat theater waiting lounge. Of course, we have some refreshments there, and typically we play these home flipping channels, which most people seem to enjoy that. We have private recovery areas that are immediately adjacent to the operating rooms. So you finish the procedure and we just wheel you just right over in a nice lounge chair to the recovery area.
Just to jump in here really quick, during their recovery, they don't have the first set of teeth at this point, do they? That's why it's
correct,
private.
because we told the viewers earlier that it takes about 3.5 hours to make that first set of teeth. The lab has to get the records and then process all of that.
I just wanted to let them know that, because I think that's also something that, you know, a lot of other places, they actually make you leave the building with no teeth. There's this one, I don't want to mention any names, but there's somebody up in Vegas Way, and the patient on the phone told me they were devastated because they had no idea that they would be without teeth, and they were without teeth for the whole day.
Yeah, well...
Now, at least with us, it's only for a couple of hours and you're in a private room.
Right.
But it just
Right.
threw me back a little bit, and, you know, obviously that's something you really want to make sure when you're calling around and getting your information, that the teeth really are that same day.
Yeah.
So they're being made up in the lab.
Right,
During this
on-site dental
time.
lab. We have a group up there, and I believe that we have a video. This is Dr. Elliot Dibbs, and he is our full-time restorative dentist. All he does is do full mouth reconstruction on implants.
I know, when he met me, he was evaluating the shape and size of my teeth. Can you believe that?
Yes,
Yeah.
I can.
Yeah, he is such a little artist. So let's watch his video clip.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, having my own laboratory here on site, this is invaluable. Not only in terms of having the control over the quality of the product that we're making, and but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
Wow. So what would you do without Dr. Dibs?
We'd have to find another Dr. Dibs.
Is that possible? Do you think?
I don't know.
I don't know.
I think that takes a special personality and everything to do that.
Yeah.
You have to enjoy what you're doing because you do a lot of it. You know, that's what we do. We get a lot of these young kids coming through here that are interested in dental school and medical school and that sort of thing. And, you know, you got to really like what you're going to do because you're going to be doing it for a long time, hopefully. And obviously Dibs enjoys what he does.
Mm-hmm.
Yep.
No, he does. He really does, and he does a great job. Let's have a little look, because there's not just Dibs behind there. We saw other people in that video. We saw
Right.
Admir, we saw the dental team. So what is everybody's position? What do they do?
Pam and Mike pretty much do most of the porcelain work, although they are capable of doing anything. And Terry and Aaron do most of the denture work, although they are capable of doing a lot of stuff too.
Mm-hmm.
And so there's a lot of cross-training up there, and the dental team, the dental lab team, they're a really good group of people.
I was going to say,
Yeah.
where do you even find the type of people that paint with porcelain and
Yeah.
make teeth like this? I mean,
Yeah.
they're pretty, like, well trained, obviously.
This is a picture of a set of teeth that are down the road a little bit, maybe 5 years or so, and you can see the difference in the wearability of the zirconia versus the acrylic. And the acrylic is porous and will accumulate stain and odor and that kind of thing, and the zirconia is glazed and non-porous and is easier to maintain. So it's just a good situation. Why don't you tell everybody about these gals?
This is Debbie and Shauna, and both of them, I believe they used to be assistants, weren't they?
They did. Yes.
Yep, so they have seen it all, definitely. These are the ladies that you would see when you come in for a consultation. Obviously, there's a bunch of us here that answer the phones and have just as much knowledge, maybe not quite as much as these guys, but we would definitely take care of you, you know, and give you a CT scan. These are the girls that you're going to interact with a lot, because they're going to help you coordinate your treatment. They're going to sit with you before the doctor comes in and just discuss everything one-on-one, and then eventually you would actually sit with the doctor, and this all happens at your very first appointment. So you get to know them from the beginning all the way to the end. They follow you all the way through surgery. I know that Shauna even, and Debbie, both of them, I see them in the hallway all the time coming to check on the patient and just make sure that, you know, everything's happy, make sure you've got your medical clearances. Things that you shouldn't be worrying about as the patient is what they or we will take care of. And that goes for all of us that answer the phones here too. If you have any questions or anything at all, that's what we're here to do, is take care of it. You know, we don't want to disappoint this guy. Or you.
This is the CAT scanner, and the CAT scanner is an open scanner, and our CAT scanner, the area that it covers is from about just below the chin up to about the hairline. So there's very little noise. It's quick, maybe a 30-second scan. The radiation is low, and you don't have to lie down on a gantry and get, you know, wheeled into a magnet and all that kind of thing. And there's no claustrophobia. So it's an open situation. It produces very nice images, and not only does it produce three-dimensional images, which are sometimes helpful, but it produces two-dimensional images down here are these 8 images, which are extremely helpful. And there's a tool up here that we're able to slide that tool around and see the cross-sectional pictures, which are these, around the entire jaw. We can also scroll up and down through the jaw. So the CAT scan, it's a useful tool. We would have a hard time getting along without it. It is important in assessing the sinus anatomy and the cheekbone anatomy for zygomatic implants, and it's a tool that we'd have a hard time getting along without the CAT scan at this level.
If you can take anything away from this webinar, and we do appreciate you spending so much time with us and talking throughout it. We had a good crowd this evening asking a lot of questions. If you can take anything away, come in for a consult. You sat through it and you listened to it for a reason. Get your smile back. Get that smile ready for the summer. You know, go to that family reunion smiling and happy and not worrying if you're wearing dentures or if you're, you know, self-conscious. Be the person that you want to be. So thank you guys for joining. We do appreciate the time, and I will be in touch with everyone just to see, you know, if you have any feedback for us. We do appreciate it. Otherwise, we hope you have a great evening. Thank you, Dr. Richards, for answering the questions I could not answer.